Hi, my name is Rashin and I will be presenting on iliotibial band syndrome, more commonly abbreviated as IT band syndrome. Before we get into it, let us first look at the anatomy of the IT band to better understand this syndrome. The IT band is made up of strong, dense, regular connective tissue that vertically descends down the lateral side of the leg. It originates from the lateral border of the iliac crest, the tensor fasciae latae or TFL, and the gluteus maximus, and crosses over the lateral epicondyle of the femur, making its insertion onto Gerdy's tubercle on the tibia. This band of connective tissue crosses two joints, the hip and the knee. IT band syndrome is an overuse injury that is most common in runners and cyclists due to the repetitive flexion and extension that occurs at the knee. This recurring flexion causes the IT band to rub against the lateral condyle of the femur, resulting in pain and inflammation on the lateral aspect of the knee. On top of the friction against the lateral femoral epicondyle, muscle tightness is also a cause of IT band syndrome. The TFL is a hip flexor, which also helps with stabilizing and extending the knee due to the IT band crossing the knee joint. The IT band extends the TFL muscle, which then allows it to function as a hip flexor and medial rotator. The IT band also allows for the TFL and the gluteus maximus muscles to stabilize and support the extension of the knee. Any injury, weakness, or tightness in either of those muscles are known to be a contributing factor to IT band syndrome. Symptoms of IT band syndrome consist of pain on the outside of the knee, more specifically around the region of the lateral femoral epicondyle. Secondary symptoms include tenderness on the lateral side of the knee or pain running up and down the outside of the leg. During flexion and extension of the knee, a clicking or a popping sound may also be heard in the outside of the knee joint. When it comes to treatment of most injuries, rice almost always helps. It is important to minimize the impact on the area and rest it. Ice helps with inflammation control and can also lessen the pain. After icing the area of concern, wrap the thigh and compress the area. While compressing, prop up the leg to elevate it. However, that can only take you so far and does not fully eliminate the problem, but mostly the symptoms. Not only does one need to treat IT band syndrome, but also extra measures for prevention must be taken. Strengthening of the muscles connected to and surrounding this connective tissue, especially the hip abductors, is highly important. Stretching the IT band will help to increase mobility and lengthen the tendon to promote healing. Using a foam roller on the lateral aspect of the thigh and rolling out the IT band can help with removing any tight knots in the tendon, henceforth helping with eliminating any future friction that would take place. On the slide, I have provided a picture of a foam rolling technique to best roll out the IT band. I personally am not a big fan of NSAIDs, but they could help with taking some of the inflammation away and alleviating the pain. Ultrasound gives off sound waves, which is used to flush out inflammation and promote circulation, but that would need to be done at a physical therapy clinic. I hope you all learned something new about this syndrome and will take the precautions to avoid it. Thank you.